Good afternoon, everyone. It's really a pleasure to be here with you today. And Songpon, but easier for you to call me Mai. It's easy for you to pronounce. Yes, my nickname is Mai. Spelling M-A-I is very related for the topic today. I'm excited to share ideas on how we can use AI and IoT to empower elderly well-being. Let's start with the quick questions. How many of the people of you in this meeting room age over 60? Or you caring for someone who is? I think it's a very, very easy question. Now think about this. How has that person been feeling throughout the days past week? And next, that person been moving their legs more since the last therapy session. It's quite a simple question, but can you remember and answer this question accurately? These questions aren't just only icebreaker. They connect us with the daily realities. They remind us for the small, everyday challenges our elderly loved ones face. And that's exactly where today's story begins. Do you have this question? Why we focus on the rehabilitation first? Because, let's face it, when seniors struggle physically and cognitively, it's not impact just only them. It's impact everyone around them, right? The caregiver feel overwhelmed when trying to serve them, but the senior feel limited. It's our pain point in the system. But what if AI and IoT could help to resolve this? Imagine smarter tools can support recovery and reduce those frustrating hospital trips. It's not science fiction. It's already happening. Here's the big picture. Thailand is aging and fast. As of 2022, over 12.9 million were over 60. And also, only in Bangkok, we saw in the last session, is about 33% of population is aging, right? And also this slide shows you that in just 15 years, nearly 28% of us will be seniors. What does it mean? It means we need to prepare. Prepare for what? We need to prepare for our communities. We need to prepare our health systems. And we need to prepare our homes. Civil smart city aren't just a cool ideas, but it's a necessity. So what do seniors really want during the in the rehabilitation centers? They want to get stronger and sharper in an environment that supportive and dignified. They don't want to feel like a burden. They want to feel empowered, right? And that's exactly what we should aim to create. Picture this. A city where I track emotional well-being. IoT devices adapt the environment to see each person's need. And also for assistive technology, make rehabilitation smarter and safer. This is just about the fancy gadgets or the devices, but it's about creating cities that are responsive, inclusive, and human-centered. Civil smart cities are about restoring independence and joy to seniors. Let me show you one of the most exciting parts of our work. Our solution for detecting and analyzing emotion in seniors. This system works in two powerful ways. The first one, we use smart facial recognition technology to detect and analyze how the senior is feeling, picking up subtle emotion cues that might otherwise go unnoticed. Because of for seniors, in sometimes they feel bad, but sometimes they feel good, right? Then it brings those insights to life with the easy to read, easy to understand reports, and real-time alert. So caregiver can stay informed and ready to respond. Imagine how impactful this could be. We getting a gentle nudge when a loved one is feeling down or stressed, and being able to step in with care in just the right moment. That's the power of this solution. Technology that not only track, but truly connect with human emotion. Let's bring it to life. The first one is IoT sensor track senior movement. And if something seems off, the caregiver can instantly alert. The virtual rehab coaches offer guidance and motivation for the seniors. Data-driven insight create rehab plan tailored to each person for each senior that they care. And emotional tracking is just it's like have a digital friend who notice if you're feeling down and not just your caregiver to check in. It's very helpful for the seniors. Here's our dreams. The senior recovery safely, living with dignity and feeling supported. They are not isolated because when you visit to the senior healthcare centers or the rehabilitation center, you will see a lot of senior in a lot of face, a lot of emotion. They want to be a part of the community that care of them. Our city become a place where every senior can thrive, but not just survive. This vision cannot happen without the teamwork. It's kind like a stakeholder for our solution. First one, the hospital and the clinics need to integrate these smart tools to their system. And also for the innovators like us, we must design solutions that work for the real people. The key message, the focus is the real people. Not focus only for the technology. Urban planner need to think about the accessibility first. How the urban can access to this solution. The researcher can help identify what works. And the family, yes, all of you, can embrace this new way to care. This is how we build a truly supportive ecosystem, like I mentioned. So we need to thinking about what the role will you play. Will you the innovator, support the family members, or you help to create smarter, kinder cities? Anyways, let's work together to make this vision real. Let's build the age friendly, take power community where senior can flourish. It's the last slide of mine. I really want to thank the great team who made this possible. They were 9 amazing people. And I'm so proud of what we did together. Each people brought something special, and I'm so thankful for them. Thank you.